The title of this podcast today is 2 Reasons Why Mamas Should Look Forward to Contractions. What a wild accusation, right? I know, but hear me out. I'm going to take you on a bit of a story. So we are born with our uterus. Our uterus is a complex group of muscles. It has a spiral muscle that runs from the bottom to the top. There's then these longitude muscles, and there's also this big juicy fundus at the top that is super vascular and super strong at the top of the uterus. Now, this uterus, when you fall pregnant, it grows as baby grows as well. Now, we actually don't know what starts labor. Now, something at the end of your pregnancy will trigger your labor to start. This will send your uterus into contractions. Now, I want you to imagine for a moment there's this big muscle that's hollow with a baby inside. Now, this muscle is going to contract, so it's going to become shorter and tighter. This will make the uterus smaller, which in turn pushes your baby down. This pressure of baby downwards would put pressure from baby's head onto the cervix, which is located at the bottom of the uterus. This firm head pressure that is given to the cervix by contractions allows the cervix to move down, forward, soften, and dilate throughout labor. Now, as the contractions continue throughout your labor, this will continue to soften the cervix, continue to, more importantly, descend baby through the pelvis, allowing you to have a progressive birth experience. That cervix will eventually disappear. Baby will descend through the vagina with the contractions as well and be birthed. Contractions are such a tangible and tactile form of life exuding from the laboring and pregnant woman. So this brings me to my first point of why we should look forward to contractions. They are the most incredible and powerful function your body will ever do. That is a pretty cool thing for your body to experience and your mind to be able to manage. My second point is that solid, strong contractions that are frequent throughout a labor and last for a reasonable amount of time is what allows you to have a progressive birth. Now, I've mentioned this term a couple of times. What a progressive birth is essentially a birth that happens from when labor starts, baby continues to descend throughout the pelvis without obstructions getting in the way, and baby will continue to descend and eventually be birthed within a reasonable amount of time. So contractions being efficient and frequent and strong is one of the 3 things that are an absolute must for a progressive birth. As a little side note, the other 2 things are both anatomical. One is the bones of the pelvis and the other is the ligaments within the pelvis to allow you to have that progressive birth experience. A progressive birth is what really allows you to avoid those long labors that can often end in cesareans and instrumental births as well. So now, in saying all of this stuff that I'm saying, yes, the body's amazing, Ames. Yes, contractions are incredible and birth is magical. I completely agree and understand why you may feel quite scared towards experiencing contractions in labor, and why, if you've experienced contractions before, it is very normal to not agree with me and what I'm saying, and that's okay. So here at Natural Birth Co, we use a multitude of methods in our birth preparation to do 2 things with our pregnant mamas. 1, we want to manage the pain of labor. 2, we want to allow the hormones to flow at their prime. So let's break down the first point first. So, managing pain of labor, so we can feel and experience pain without fear, without a sense of unsafety, without stress, and without resistance. But instead we can feel the pain and birth anyways. We can feel the pain and see it as a positive and progressive pain that is meant to be there, not a pain that we need to avoid. This sort of perception of pain is what creates panic and franticness. I always like to use this analogy where, say if we go for a big run and the next day we go to sit down and we feel pain in our legs, our muscles are sore. We don't get scared, we don't freak out, we don't get frantic, we don't feel a sense of unsafety, release adrenaline and avoid the sensation. Yeah, we may not love it, yeah, it's a bit uncomfortable, but we know that it is the normal, physiological process of the body. We know that we are safe, we know that we are healthy, and we know that that sensation is meant to be there. Now, when it comes to, say, cutting our finger with a knife accidentally, we release a massive dose of adrenaline, we feel unsafe, we get this frantic energy, we're very much in our logical frontal lobe, and we are trying to stop this bleeding, we're grabbing things, we're trying to stop this bleeding, getting all frantic. That is a sense of unsafety. That is a sensation that is not meant to be there, that is pathological, we would call that, whereas pain in the legs is physiological. Birth and contractions are a physiological pain that is meant to be there. You are safe. It is a normal physiological process of the woman's body to go through these contractions during labor. That is where we're really working on changing the pain perception. So with practical tools that you can learn, you can manage and distract yourself from pain so that this feeling of pain is much less. And then you can also really work on changing your perception of pain so that the pain that you do feel, we're not afraid of. We're not running away from, we're not avoiding or resistant or feeling the need to fix it. Like we do when we cut our finger, we need to fix it. Whereas when we're sitting down after a big run, we let it be there and we know that our body's just taking care of it and that it's healing. We need to let the contractions be there, let our body take care of it, and let it birth our baby. So in our natural pain management method, we break these two parts down to teach our mamas exactly how to cope with pain in labor. This includes 10 natural practices for both you and your partner to integrate during labor to not only feel less pain and distract yourself from pain, but also perceive the pain you feel differently and much more positively. Secondly, we have a strong focus on allowing our natural birthing hormones to run at their prime, to cultivate the contractions your body needs to birth your baby. So this is a perception that I really like to explain to our mamas because it leads to one of my favorite birth affirmations. Keep in mind, your body creates your hormones create your contractions. So your body will instinctively, intuitively, innately create your contractions that your body needs to birth your baby. And this leads me to the affirmation. Your body would not create a labor that you cannot handle. Your body will absolutely give you a labor to birth your baby that you can handle. Horns. Freaking love that. Absolutely love. Anyways. Okay, so yes, we're talking about the natural birthing hormones. So this is a beautiful natural flow of hormones, the hormonal symphony as Rhea Dempsey calls it. So effective hormonal release will create effective, strong contractions that are frequent and progressive and lasting for a reasonable amount of time. Now, erratic and uncoordinated hormonal release will create uncoordinated contractions that are unprogressive towards birth. So to achieve the first, firstly we utilize our birth partner integration method. So the birth partner and their role consumes them during birth is the ultimate contributor to you having amazing contractions. This is through them effectively keeping your birth environment. This is through them providing you with a sense of safety, undisturbed and unobserved. This is through them intervening and interrupting anything that comes your way to try to get into your birth space and get you out of that labor zone, which allows you to really stay in your intuitive hormonal labor mind that you need to be in to have that continual flow of natural birthing hormones. And this is something we always really integrate in to our birthing mamas, is that a big part of what we do is we just simply stop the interruptions. You guys have everything you absolutely need. As long as we allow your body to be fully prepared and we allow you to remain fully calm during labor, get into your intuitive mind during labor, your body knows what to do. We are just avoiding distracting you, interrupting you, and taking you off your natural path during labor. So, What also comes into this is our minimal medical intervention protocol. The simple act of your hormones running effectively reduces your risk of receiving intervention. So this is particularly when I'm talking about the Syntocin drip or the Pitocin drip if you're from the US. So this is a synthetic version of hormones that is intended to create contractions. So this comes with a whole bunch of different risks, and when you have effective hormonal flow, you completely mitigate the need to receive an oxytocin drip at all. Okay. If you and your partner So there we have it. 2 reasons why you should look forward to your contractions, because you are powerful, you are strong, and they are meant to be there. If you are interested at all in learning exactly how to cope with pain in labor, getting your partner to learn how they can support you and how you can continue to avoid receiving medical interventions during labor, then check out our Accusation Birth Workshop. The link is in the show notes of the podcast. The dates are already booking out for next year, 2024. So make sure if you're keen on coming that you jump over as quick as you can to secure your spot. Thanks so much for listening.